Good afternoon, everyone. I hope everyone can see and hear me. We're happy that you're here today on this wonderful, beautiful Friday. I know a lot of us would rather be outside. I'm coming to you here from Waldorf, Minnesota, which is in Waseca County in the southern part of the state. And I know that I think hopefully the farmers are going to be getting their soybeans in this weekend. I know that we're going to be out in the garden as well. So hope you can all hear me, and thank you so much for joining us today. We have over 200 people actually registered for this webinar, so thank you to those who have registered. I am going to switch it here to share my screen, and as you all know, in this day and age of Zoom, please show a little grace if it doesn't work the first time, but we're going to get started here. All right, there we go. And you'll be able to see the presentation here. Let's see, will I be able to? Yes, look at that, wonderful. And you'll also notice on the side we have Kelly Ash, who is a research assistant, and we have Zora Radosevich, I hope I'm saying your name right, with the Department of Health. And you'll be seeing us on the side as panelists when people join. But just to get things started, I wanted to just give you kind of a little bit of a highlight. And you might be wondering why rural in the middle of all of this COVID response? Why are we focusing on this? And like I said, we have over 200 people watching today. And I think that shows to me that rural residents across the state are concerned about what is going on with COVID-19 right now. We have a range of small business owners, county commissioners, newspaper publishers, legislators, and farmers, just to name a few. We also have just concerned citizens just wondering what specifically is that rural response looking like currently, and what will it roll out to eventually as well. The response, like I said before, has been strong on this webinar, and so we weren't quite sure when we put this out earlier in the week, how many people we would have, but we have been very happy to see the response from people. So thank you, and thank you to those who have submitted questions already as well. Obviously, like I said, rural residents have specific concerns when it comes to their families, to health care, and to their small businesses. Some may ask why we need a specific response to COVID-19 in rural areas. And those of us who live and work in rural areas know that we share a lot of similarities with metro areas, but we do have some differences as well. Like metro areas, we have diverse populations. I think that's something that people don't realize is we have very diverse populations in different parts of Minnesota. Also, traveling for healthcare can be a burden and can take some time. And so when we're talking about testing and whatnot, and ICU beds, that can be concerning. And then also that a larger proportion of our rural residents are small business owners, and so the economy is really being affected out here. And then also our farmers are in rural areas, and I'm sure we've all been watching the news lately, seeing the effects that COVID-19 is having on agriculture in Minnesota. So there are some very specific things that COVID-19 presents for rural residents. And we're hoping that today we can shed some light on those topics. We don't have much time, but I am so very grateful that we have panelists from DEED, from Department of Ag, and from Department of Health with us today to specifically talk about those rural issues. And while we're waiting to get them on the line, I'd like to actually introduce you to the Center for Rural Policy and Development. And I guess I don't know if I introduced myself before, but I am Julie Tesh, and I am the President and CEO of the Center for Rural Policy and Development. We are a nonprofit organization, and we were founded in, little grace there. We were founded in 1997 by the state of Minnesota. And what we do is nonpartisan, nonprofit policy research. We do have a board of directors, and we do have 3 staff members as well. And so the research that we do is come about every year through a thought leader survey. And those will be going out here shortly within the next week or two. So hopefully you all can receive a copy of that and let us know what are the issues pressing in your rural area. So like I said, we take those complicated and complex issues and present them in ways that give them meaning and relevance. We all know that state departments have so much information, they have great staff, but sometimes it's hard to disseminate what exactly those policies and those things mean. So our research, we don't determine public policy, we like to inform the decision makers. And so we work with state legislators, we work with county commissioners, with city councilmen, with administrators, just to try and help them, give them that rural lens. Because like I said before, when we're talking about healthcare, healthcare looks very different in the Twin Cities than it does in Marshall or in Mankato. And so we put that rural lens on there. And something I want to mention as well is all of our research is free for you to use. We are partially funded by the state and then also partially funded by private foundations. So all of this information on our website is free for you to use. Please use it. We hear that a lot of people like using it to apply for grants when they're looking at all different grant programs. So please encourage you to use our information. Some of you might be wondering who have not heard of us before, what our latest research is. What exactly do you research? And our latest research, we had a 4-part series on workforce. Up until 6 or 7 weeks ago, we had a major workforce shortage. And that is something that several of us know about and felt acutely, but I don't think it was something that was shared far and wide outside of some of rural areas. I think some decision makers still thought that we needed jobs out here when actually we need people. And so that study, that report was put out last year, and we've been working on updating it throughout. And now again, the last 7 weeks, obviously workforce has changed very significantly. So that research I think will be very good as a point in time marking history on where we were before COVID-19. So I encourage you to look through that. That is a actual 4 or 5-part series. And on that too, we focus on youth and keeping youth in rural Minnesota for jobs. We focus on the hard to employ. So those workers that may have disabilities, those people who may be previously incarcerated, those in poverty, we look at ways on trying to include them in the workforce. And then another one of our previous research projects was on addiction. And again, we've all heard about addiction problems across Minnesota. And the thing that we hear about more consistently is opioids. But we know from doing our study, and I know that many of you know living in rural Minnesota, that actually the bigger problem is still meth. And our study shows that quite a bit. Opioids are still definitely a problem, but meth here in rural areas is still, by and large, the biggest problem. So we have a research study on that. And then we do have a research study coming out here in the next week or two on actually rural healthcare. And we started this several months ago, well before COVID-19 was ever thought of. And this research study is going to be focusing on mergers and acquisitions in rural healthcare. So we're going to be talking about price, we're going to be talking about access, and just going through those things. And actually, if you would like to get a sneak peek of what that report will look like, you can go to our website at ruralmn.org, and we have a blog there, and you can see we have a kind of teasing it out, a 5-part series there. So I encourage you to take a look at that. All right, what we also do is we have a state of rural. Every year we are required by the state of Minnesota to do a state of rural, kind of a state of the state on what's going on in rural Minnesota. And you can see here, when you go to our website, I will show you where you'll be able to find that, but you'll see in the bottom left-hand corner, there's a tab that says go to the Atlas of Minnesota online. We have created a really great, dare I say fun, for those of you who like statistics and data, a fun interactive tool so you can find your county and you can look at different statistics for your county, whether that's employment rates, diversity, job growth, all different things. And so we're updating that to be put up here in the coming months. So the State of Rural will be for 2019. And so we're very excited about that. And again, we encourage you to use this information, and we'll be having a whole report coming out on this. And I think in the day and age of COVID-19 that this State of Rural will be very helpful as we move forward trying to figure out what those policies and procedures are. Quickly want to introduce our staff. We are a lean and mean staff. In the photo here on the left is Kelly Ash, our research associate, and he lives with his wife in New London. Marnie Werner is our VP of Research and Operations, and she lives in Mankato and has been with the center for a really long time, a very long time. And then myself, Julie Tesh, I'm president and CEO, and I reside on my family's farm outside of Waldorf, Minnesota. And then we also do have some interns who help us out from time to time, and they're just fantastic to work with. I also want to mention our board of directors, and I guess you won't be able to see all of them there because my picture's on the side, but we have a great board of directors. We can have up to 20 board members, actually. We have 19 right now, and the majority of them are appointed by the governor. 15 are appointed by the governor, and then we can have up to 5 that are appointed by the board as at-large members. And so a very dedicated board from all across the state. We have a member up in Roseau, we have a member in Harmony. So we go across the state, we go across industries, and we're just very proud of the board that we have. Also want to mention, if you are curious about what we do, especially if you've never heard of us and trying to figure out what exactly do, we just launched a new podcast here in the last month and a half, 2 months. And I'd like to feature 2 podcasts that we have. Episode 2 with Santo Cruz from Centricare Health, talking about rural healthcare. And then, or actually Santo is episode 3, I apologize. Sue Grafstrom is episode 2, and she is from Roseau County Emergency Management. So if you would like to hear her talk about county management and how they're preparing for COVID-19, please check that out. And you can go to our website, again, at ruralmn.org to get that podcast. We also do have a blog series. We started a blog last year, but now with COVID-19, we have kind of switched up what we're doing. And so we have a blog series now talking about the rural lens and talking about COVID-19. So if you go to our website and go to our blog page, you'll be able to see just smaller snippets of pieces that we've written, whether it's on small business, whether it's on tourism, whether it's on food access. We like to share information from the state. We like to share information from Extension, and it's just a really good way to keep, we like to keep people updated on what's going on. So please check out that blog series. You can also find us on social media. You can see us on Facebook, on Twitter, LinkedIn, and we have a brand new YouTube channel, actually, if you look for the Center for Rural Policy and Development. We're very excited about that. We are working on curating some videos to talk about our research, because those of us who like research, reading a research paper is fun. But we know that in order to help policymakers and decision makers to get interested in learning about data and research about rural Minnesota, that we have to make it a little more tangible and a little more fun. So we have started some videos. And so we're very excited about that. So you can go to our YouTube page and look at that. Actually, this is our first video that we put up. It's called What is Rural? And our videos are only between 2 and 5 minutes. They're very quick. They're very easy to look at. They're fun. We'll be having a new one coming out very shortly. So yes, so I hope that you'll all take time to check us out and what we're doing. And again, if you would like more information and want more research, the best way you can actually find everything from us is to sign up for our newsletter. And if you go online on our website, again, ruralmn.org, you'll be able to sign up. And we promise not to spam you at all. We send out a monthly newsletter, or in the case of where we have had this opportunity to have this webinar, we did send out 2 emails in 1 month, but we thought that this was a very important thing to get out. to our stakeholders and those that are interested. So you might be wondering, what are we discussing today? And we asked citizens, stakeholders, to actually let us know, submit questions. And I want to thank everyone for submitting those questions to us. People did very well. Some of the things that came in today, questions were talking about the role of rural newspapers, talking about rural healthcare, of course, talking about agriculture and specifically migrant labor, talking about agriculture again, talking about childcare in rural areas, and talking about tribal nations as well. So those are the things. So today, our first speaker coming right up will be Commissioner Steve Grove. And Steve, are you on right now?
I am. Hi, Julie. How are you?
Hey, doing great. How are you doing?
Doing
Let me
okay.
see if I can find you. Happy Friday, yes. So Kelly, should I pause my, I'm just trying to get you on here, Steve. There you are. Whoop. There's Thom. So today we'll have Steve, and then we'll have Commissioner of D, then we have Thom Petersen, Commissioner of Agriculture, and then we have Zora Radosevich, who is with the Minnesota Department of Health and with Rural Health and Primary Care. So I want to thank you all for joining us, and I'm going to turn it over to you, Steve, and I'm going to stop sharing my screen. And there you are.
There we go. Hi, everybody.
There you are.
Well, thanks for having me and for convening this forum. I think it's a great way for us all to connect and to hopefully answer some questions, and for me to learn a bit more about what's on your mind across the state as we think about our response to this extraordinary pandemic that we're all facing. It's been unprecedented times. And I guess just by way of a little bit of an introduction, you know, our Department of Employment and Economic Development has been very focused, you know, early on in the sort of response effort of providing some safety nets for people and businesses across the state to be able to manage this time as effectively as possible. The first one was, of course, unemployment insurance. We moved very quickly, faster than most states, to get executive orders in place to open up unemployment insurance for cases in which people were affected by COVID-19, whether it be they themselves were at risk or had to take care of a family member or simply had to stay home to take care of kids because school is closed. We've opened up our program for those new and unique cases. We also were one of the first states in the nation to implement all of the federal CARES Act policy proposals that are policy changes to unemployment insurance that gave an extra $600 per week to applicants, that extended the program by 13 weeks so that everybody could be on for longer, and also provided unemployment insurance to self-employed and independent contractors, which you know is very relevant to this group because many folks in rural parts of the state are self-employed and need to be able to take advantage of that benefit at a time when regular work is not possible. So unemployment insurance has been the big first step. I think the other one has been small business loans and small business assistance. We moved very quickly to get the SBA program up and running here and to pass some legislation to get some state dollars moving as well. And, you know, there's not enough of it, that's for sure. And it's tricky and difficult to apply for and take advantage of some of these levers, but they're important. And so those have been a big part of our early focus. And then really a lot of our energy right now has been on how to get this process of reopening the economy right. And you've seen some of the things that we've done in the past week as the governor has rolled out his model for addressing the reopening of our society and of businesses. The dial on the spectrum of sort of what we can do there starts with, you know, smaller and more predictable settings and turns up towards less predictable and larger settings with more contacts. And, you know, very important that we move slowly and carefully and methodically along that dial, making sure that we have the right health guidelines in place, that the data supports the decision, and that we have a very good plan for every step along the way. And so that's been a really important part of this to make sure we get this right for the state. And I would just say that it is not state government, you know, sitting around in St. Paul figuring this out on our own. We are in deep consultation with lots of different groups, venues like this are so helpful for us to hear what's on people's minds and to get really into some of the specifics on how to get these steps right. We talked to hundreds of retailers before yesterday's announcement to make sure that curbside delivery and pickup guidelines were in line with what the industry has recommended, and that this kind of phased approach of starting with delivery and pickup and then moving later on into opening up retail itself is the most thoughtful and useful way to proceed. So this is the kind of thing that we've never had to do before. There's not really a playbook for it, but we're only going to get it right if we're partnering. And so I'm really grateful to be able to talk to all of you about it, get your reactions to what we've done so far, what you think we're getting right, what we're not getting right. I did just want to say, we know that this crisis hits rural parts of the state differently than it hits the metro. When you look at some of the data that we've put out there in terms of unemployment insurance applications, you can see the map itself of Minnesota, the counties where it's been hit hardest. We know, just as an example, look up at Cook County, 31.1% of the labor market isn't working because of the tourism impacts of this crisis. It's just as one example, right? And we know, like I said before, that a lot of individuals in rural parts of our state are self-employed and independent contractors. And so unemployment insurance has been tricky for those individuals to get moving. And, we are working night and day on getting those applications processed and getting money out to people. And we just know how important it is. And so I'd love to hear your questions specifically as it relates to rural, and I'm happy to be here and grateful for the time.
Thank you so much, Commissioner. Actually, what we have, Marnie Werner, our VP of Research and Operations, she is going to be asking some questions that we've put together. So Marnie, I will turn it over to you.
Okay, so this is kind of a conglomeration of all the questions we've been asking. And so the first one is compared to urban areas, rural Minnesota tends to have a significantly higher percentage of 1099ers, those residents who file as self-employed. And we've heard from many of them saying that they don't qualify for programs such as payroll protection program or unemployment insurance. And what has the state been doing to help out those small business owners? And are there things that they're just not aware of that they should be looking into?
Great question. The tricky part about pandemic unemployment insurance is that we have to be able to ensure we protect the program against fraud, because unemployment insurance usually tracks people's income over time, and we don't have that data in the same way that we do for folks who are covered by the program. So if you're 1099 or a self-employed individual, we've had to find new ways to get income histories through the Department of Revenue that just took a ton of new data sharing and actually technical work to build out the system. So we are up and running. We are paying people out. We've paid, I think, 50,000 people out so far, $72 million worth of benefits. And I think people are confused because if they've applied up till now, they might get a message saying that they're denied, because traditionally unemployment insurance doesn't pay out money to self-employed individuals. But if that's the message you're getting, don't worry. You are likely eligible, and we will proactively reach out to you once we've cleared your account. We're kind of going through massive tranches of applicants, by the day, by the thousands, to clear issues and ensure that we have the right payments going to the right people, and that we're preventing frauds, that every Minnesotans get every single thing that they deserve and no one else is taking advantage of the system. So we know that's a pressing issue in rural parts of the state, and we're working hard to make sure we get it right.
Okay, great, thank you. Next question, as we've been tracking at the center over the last few years, childcare is a vital piece of keeping people employed and employers in business. But the shutdown is hitting both private providers and public school providers hard. For example, the Benson School District is losing $5,000 a week providing care for children of essential workers. So what's in the works to keep our already beleaguered child care industry afloat?
Yeah, it's so hard. I mean, childcare has been such a difficult issue in the state even before the crisis, to your point, Marnie. And I think, we are doing everything we can through some grant money that was passed at the state legislature to help keep childcare businesses afloat. If you go to mn.gov/childcare, you'll see a whole host of resources there. Childcare is available throughout the state. And those grants are important to make sure that it happens really effectively. But it's hard, and I know a lot of parents, are become childcare providers themselves, in the sense that during the day now they're helping their kids distant learn in a way they never had planned to have to do before, and that's hard. But having the schools open up and being able to do some of that is helpful. And so I know that comes at a cost and it's challenging, but it's important. And I think that the Children's Cabinet has been doing a lot to cobble together and help create support resources and mechanisms and grants to increase slots at a time when they're really needed.
Okay. And will there be more planning on that for the longer term?
Certainly. Yeah. I mean, I think that the childcare has been, as you all know, I'm sure, one of the main priorities of the governor's strategic plan, to make sure that we tackle those shortages. And the Children's Cabinet's sub-cabinet group on this is led by DEED, so we're very much in this. I think that the work has shifted to emergency response in these weeks, but that long-term sub-cabinet focus on childcare is a critical part of the governor's plan and will continue.
Okay, thank you. Employment and earnings in rural communities tend to be dominated by one or two employers. For example, JBS in Worthington, tourism in northern Minnesota, and their closures have an outsized impact on the local economy. Has DEED done any work on identifying communities that are economically vulnerable like this? And are you working with them to ensure safety and being able to keep them open?
Mm-hmm. Yeah, we do. In the case of JBS, we have a rapid response team that has gone out there and has been a very integral part of the response. And that's actually built into how DEED works. We have a team that, when there's a major layoff or crisis and there's people that are out of work, we move in very quickly. One, just to educate people on unemployment insurance so that they know how to apply for that. But two, and more importantly, to try to provide some workforce development opportunities if the shutdowns are going to be longer term, to find new jobs. So we're doing that in Worthington. We're doing it elsewhere. It's kind of a core part of our model as an agency, and you can expect to see that to continue to play out when it needs to.
Great, okay. And probably our last question. Some of our rural communities have highly concentrated employment in specific industries, as we just mentioned, and many times their employers are made up of various immigrant and refugee populations. How has the state been reaching out to immigrant and minority populations in greater Minnesota to communicate important safety protocols to them, including through their employers?
Mm-hmm. Well, it's a great question. A couple things. One, the deputy commissioner at DEED, who runs our workforce development department, is an immigrant himself, a Somali immigrant named Hamza Warfa. And so he's been leading this effort for us. On one hand, we are doing a lot of ethnic media outreach. So we're both buying ads, but also appearing as often as we can in ethnic media to share messages around safety and unemployment insurance and job seeker services, et cetera. So that's a big part of it. We also hold a regular every Monday, Wednesday, Thursday sort of community call that reaches out to nonprofits and advocate groups who work in this space, where we answer questions and give policy updates on things that are evolving, which is useful. And then we are in the middle and near the end, actually, of a hiring process to actually hire an assistant commissioner for immigration and refugee issues at DEED. And that's a really important position. It's never existed before in state government, but we're really eager to get that person hired and in the building to really run point on this stuff day in and day out to make sure that we get it right. Some of the stuff's simple, like making sure that our unemployment insurance site is in as many languages as possible. Other things are more complex in terms of some of the deeper challenges that are faced, but it's an important priority of this administration and one you're going to continue to see us pursue.
Okay, do we have time for one more question?
Sure.
Okay, let me see. We had a question here. I was told to ask about newspapers, and basically we have a lot of small newspapers that are really crucial to greater Minnesota to just getting information on local news, the local city council, county board, school districts. This is the news that nobody else covers. you know, the reporter is the only news outlet showing up at these meetings and getting this information to the community. But a lot of these newspapers are really struggling now. Their revenue has cratered. And so is there anything they qualify for? Any assistance that the state can provide, like even just taking ads out in the small newspapers for PSAs and things like that?
It's a great question. I don't really have a great answer in the sense that I haven't been running point on newspaper support, although I'll say that having been a journalist in my 20s and had my first job being at the Northfield News, I'm very sympathetic to the plight of rural newspapers. And my previous job before this one was I built a team called the Google News Lab at Google that was focused on revitalizing the news industry across the country. So I couldn't agree more that good journalism has never been more important than it is today. With regards to state purchasing of ads, I think there's some of that happening, and some other areas are challenged. Of course, one of the big revenue challenges the state government faces is that as these shutdowns have happened, tax dollars dry up, and even our revenues are hit too. So there's some spending issues at play there, but I think it's a good point. It's something we should continue to talk about as a team. It may be happening in other departments and areas that I don't know about. I haven't really been keyed in on that issue, but I think it's really important, and I'm glad you bring it up.
Great, thank you.
Well, thanks for having me, everybody. I was just the warm-up act to the main show of Commissioner Petersen here, so I'll get out of your way. But again, just wanted to thank you for having me and for your hard work and your advocacy on behalf of rural communities in the state, and hope that you can continue to share the great research and guidance and policy work that you do. We're all better for it, and it's never been more important. So thanks for having me, and we'll talk soon.
Great.
Thank you.
Thank you so much, Commissioner. Thank you for your support of our work.
You
Really
bet. See you
appreciate
later.
it.
Thanks, Julie.
See ya. Bye. And now we have Commissioner from the Department of Agriculture, Thom Petersen, a friend of ours as well. I've known Thom for a very long time. And obviously, I know there's a lot of us out in rural Minnesota that work directly in agriculture. And so, Thom, I'll turn it over to you for just a few comments, and then we also have some questions that we've put together as well.
Sounds good. Thank you, Julie, and it's good to join everybody today, and good to follow Commissioner Grove. Commissioner Grove is he's a breath of fresh air, and dealing with all this. I always say he's an ideas guy, and we need all kinds of ideas right now in this situation we're dealing with. I try to make myself and our department as available as possible. I get, I'd say, kooky ideas every day, but we get a lot of great ideas. We have companies calling us saying, I have this product or this idea, or we could do this with livestock or help with that. And I think that's what, is a great part about whenever we see something that on this magnitude that, happens in our country, that people come together and really try to figure out how to move forward. And that's what, we're trying to do at the Department of Agriculture. Unfortunately, right now, we're really in a triage situation. We're really get thrown a lot of curveballs every day, things we hadn't anticipated, really come up. And right now, you probably all are very familiar with what we're facing with our larger scale meat processing, and really it affects our smaller scale processing as well. And so that's taken a big priority for us. At the Department of Agriculture, as we think about rural development, I'm very proud of our marketing staff that we have at the Department of Agriculture, our marketing division. In this COVID-19, they've really stepped up, been creative. We've had to think out of the box because our big trade shows are canceled. Our big pavilions where we feature Minnesota companies, all the things that we've done, just like all of you, it's not business as usual. So we have to be creative, and we have a lot of good thinkers on our staff, and and just people who are willing to jump in and try to assess what's going on. Another question I get is, big picture questions about our food system and what are we going to do about our food system, and right now, I think that we can begin to have that discussion as, is our food system going to look different on the other side of COVID-19? Are we going to, what are the discussions we're going to have so that we're not in this situation again? You know, and is that possible? And so I think that's, you know, it's fascinating. Every day too, from large scale with the issues we're dealing with you know, Smithfield or JBS, all the way down to farmers markets, and how do we effectively social distance at farmers markets, and how do we help people find CSAs? We have CSAs that are sold out this year, and I get calls every day from people who want to find a CSA, and that's a great opportunity for a lot of people. So it's a lot of it is about just connecting. I also want to encourage people to always check out our website for any type of grants and assistance for the department. And also our COVID page has a lot of information as we try to look at that. One last thing I think is really interesting in our rural economy is our trade. You know, not a lot gets talked about that right now, but our you know, this isn't just a Minnesota problem or United States problem. This is nationwide, but worldwide problem. And so our state depends on trading products. We grow a lot of commodities, and we're good at growing them, whether it's corn, soybeans, ethanol, wheat, grains, everything. And we depend on income from shipping those to other parts of the world that need them. And so the quicker too we can get that forward, that'll help our rural economy. So with that, I'll just leave it at that, and glad to answer some questions, and appreciate having me today, and appreciate all the work the center does.
Great, thank you, Commissioner Petersen. So let's just start with those packing plants. In what ways can President Trump's order to reopen packing plants be balanced with safety for employees, consumers, and the community?
Yeah, and I think that, you know, President Trump's, you know, his order, you know, it was helpful to some and then confusing to some, and but it just highlights the issue. And I think that it doesn't mean that they're going to open right away. The bottom line is those plants need workers, and if the workers don't feel safe, they're not going to come to work. And if they don't have a good, safe environment, and the plants know that too as well. And so I think that there's a real awareness and the importance of the workers that's really highlighted right now. You know, we've had plants across the upper Midwest where we've had the workers walk out if they didn't feel safe. We had it happen yesterday not in Minnesota, but in another state, and it closes the plant down. And so the plants in Minnesota that I talked with are working really hard. We have about 24 large-scale meat packing facilities in Minnesota. 4 of them are currently down right now, and a couple of them have cases, but they're working. It's impressive what they've done to try to help the workers stay safe. So the bottom line is we're working closely with all the companies to make sure that the workers feel safe, and they'll follow the guidance set out by the CDC, so we can open the plants that are closed and keep the plants running that are running currently.
Okay. The second question is related, and this comes from a farmer in western Minnesota. With the problems caused by the shutdown of large animal processing plants, what alternatives is the state working on, such as helping move more processing to smaller scale animal facilities?
Yeah, that's a good question as well. And you know, before we had COVID-19, we had a backup at our local processors. We have almost 300 custom to and equal to plants in Minnesota, as well as a few smaller scale USDA plants. A lot of farmers before we had COVID-19 had 6 to 9 month waits. So when I became commissioner, that was one of my top priorities, was to try to build that capacity out. Now it's more important than ever, as farmers that are selling directly during COVID-19 are telling me they have 4 and 5 times the business that they normally have. And so that's further stressed that system. So what we've done at the department is we accelerated some of our grants through our value-added program. We did 9 grants 2 weeks ago to several plants. We're moving plants that are customs to equal to if they would like to, and I'm really proud of our staff in our meat division for working with those plants, and they can do that in a week time. In some cases, the plants just need to call and work with us, and we'll work with them. We also have a grant open right now. It's a mini grant, and we just are approving the first 4 grants of that today. Those are $5,000 grants to lockers. One of the issues on that too is storage. They don't have a lot of storage capacity at a lot of these plants, and so that's a big issue. Keep in mind the magnitude of this issue though right now with the hogs. With JBS going down and 20,000 hogs a day, and 80% of their hogs come from Minnesota. Smithfield being down, almost 40% of our hogs went to Smithfield. I stopped at a local locker plant this week, and they were told me they kill 10 hogs a day. They can take another 2 hogs, and then they're running Saturdays, so they take 20 hogs off the market. But in that town where they were, we could open the door to that locker plant. We could see 25,000 hogs from that door. So the local part is very important, and working with our local producers is important, but it's a very big magnitude issue right now.
Okay. Let's see, next question. At a recent news conference in Worthington, there was a discussion about potential compensation to farmers who need to depopulate healthy animals. While that is a federal issue at the moment, is the state considering something similar?
We are, and right now the compensation for farmers that are depopulating is through the NRCS. They can go and apply. That is a finite amount though, and we're continuing to look through the federal government first. The state, as you know, we're going to release a new forecast, or maybe you don't know, but we are going to release a new forecast May 5th, so next week. That will really depend on if we're able to help out some of our farmers financially, but that is on the table, and we're going to have to see what we can do there.
Okay, thanks. This next question comes from one of our tribal communities. Minnesota's tribal communities live in mostly remote areas of the state, and they are or can be concerned about food security, and so they're wondering how the state is working with them on various aspects of the pandemic and safety, but specifically in food security, making sure supply lines stay open.
Very proud of the work that we've done with our tribal partners. As commissioner, this past summer, I hosted all of our tribes at the department, and it's really exciting to see all the work that our tribes are doing in agriculture, and to work on this idea and issue of food sovereignty. I'm also very proud to announce the Department of Agriculture has a new tribal liaison position that is working with our tribes to identify a lot of the issues that you just mentioned, Marnie. And so there's a lot of tremendous opportunity as tribal governments really try to build out a lot of different things. The Fond du Lac, Mille Lacs, all the tribes, White Earth, Red Lake. I was at both Red Lake and White Earth this summer or this fall, and to see the things that they're doing are really important. So I'm excited about that, and excited to get to work with our new tribal liaison to help our tribes and move forward.
Great. And we have time for one more question about racing. Okay. This question just came in. Are race venues able to host races without fans if they have a social distancing plan in place?
One of my favorite topics as a horse person. This is something that I worked on quite a bit. Just yesterday, it was announced that both Canterbury and Running Aces, north of the cities, are considered Class 1 race tracks, and they're allowed to open up their tracks to accept horses. And so that is the step that the state of Minnesota took yesterday. A lot of those horses are in Arizona, where it gets really hot starting this time of the year, and they needed to move this way, somewhere between 800 and 1,000 horses eventually. But at this time, the racing is not allowed. Some of the tracks you might see around the country are open and running, but with no fans. And so Minnesota does not currently allow betting if you're not at the track. And so I think there's bills in the legislature that would address that. And I don't know if that'll happen or not, but then the current order was just about the horses being at the track. So there'll have to be more work done by the Minnesota Racing Commission and the two tracks to come up with a plan to allow racing, but at this time it's not.
Okay, great, thank you. And I think that's all the questions we have for ag.
Yeah, but we have a couple more that came in online here, but
Are there more?
we know that we're at a time crunch here. So
Okay.
thank you so much, Tom, and maybe we'll get those questions to you here afterwards. But you're very welcome.
Thank you.
Yeah, thank you. And then finally, we have Zora. Hello.
Hi, thank you for having me.
Hi. Now, did I say your name correctly, Radosevich?
We're very close.
Or not even close? Okay.
No, very close. Radosevich.
Radosevich. All right. OA, that's fine. But thank you so much for being here today. Obviously, you're very passionate about rural health care and being in Minnesota, so we're very fortunate that you could join us today. So I'll turn it over to you for a few comments, and then just like with Tom and with Steve, we do have some questions that were submitted that hopefully you can answer.
Okay, great. Thank you. And thank you for having me. So I am the director of the Office of Rural Health and Primary Care, and the commissioner asked if I could meet with you today. She wasn't able to be here. So I wanted to start out by noting that even though most of the rural communities in Minnesota may not have had the same impact as the urban communities so far with the COVID-19 disease, this delay really should be taken as an opportunity to continue to prepare for when it does come to our communities. It doesn't mean that we're home free. So at the state and in our office in particular, we're administering funding to healthcare facilities across the state and providing technical assistance as well to health facilities throughout the state and including our critical access hospitals. We've administered a $50 million emergency response grant program that was passed by the legislature toward the end of March and signed by the governor. And that was to pay attention to the needs of facilities, again, all around the state, to help them prepare in an emergency way to really look at the next 2 to 8 weeks of preparation that was needed. We're now in the middle of the second round of state funding through a $150 million healthcare response program, and that's making more funds available to address the issues related to COVID-19. So the state, through other offices, through the Department of Health and other state agencies, and we've heard from commissioners of Deed and Agriculture, and we know that Human Services and Management and Budget and others are providing resources and working with communities to prepare for this new normal in being in public and in operating our businesses, our educational institutions, and really all of our activities. As we've seen in Worthington and other parts of rural Minnesota, a hotspot can develop really quickly. So we need to continue to do all we can to keep them from happening, but also to institute practices to contain outbreaks when they do occur. The modeling that's being done by the state is good at helping us understand what's likely to happen once the illness is in an area. And it can show us how it's likely to move and maybe at the speed that it's going to move through a community, but it really offers no insight into where it will happen next. And really that's what most everybody wants it to be able to do. And that isn't what it is able to do. We're continuing, I spoke with the folks who are working on the modeling. We're continuing to improve the model so it has a better ability to reflect what's happening in Minnesota and in rural areas in particular. But to do that, we just need to keep collecting better data on patterns of contact. So for now, many of the models in the US are using European contact patterns. We're starting to get data from New York and Washington State and other parts of the country and within the Twin Cities as well, and that will help with better modeling. The modeling, we need to be able to measure our adherence to social distancing practices. So how well are people practicing social distancing methods, and how will that affect how the disease spreads once it's in an area? And then we need to also include an introduction to the number of positive cases, and more testing will give us a better understanding of where the disease actually exists. So if we ask, what do we know from the model and from our experience, rural Minnesota, we know, has a lower population density. And so then less intermixing of people simply because the numbers are lower, they're smaller per community, and people have greater area per person. So it is feasible for us to assume that it will move toward an area at a lower speed, but once it's in an area, it continues to move exponentially. Social distancing, we know, using personal protective equipment, stepping up our sanitation practices has helped flatten the curve. And while that doesn't mean that the disease won't hit, it does mean that these practices will slow the rate of infection. And that's allowing our communities time to react. It's allowing us to practice to isolate people when they are sick, and that again will slow the spread. So even with lower numbers, and really this is probably the biggest point that I would want to make today, the fact that there are fewer people in more space doesn't mean that we won't have to deal with this disease. Another thing we know is that when an outbreak happens, and this can happen, you know, in many ways, but when it happens like through big events like weddings and funerals, communities can be really hard hit and really fast. And we also know that as it spreads through a community, and especially when it spreads quickly through a community, the hardest hit are older people and those with underlying health conditions. And that's another fact about rural Minnesota, is that we are an older population and we do have more chronic and underlying health conditions. So the pool of people in many of the rural parts of our state are at higher risk once the illness reaches their community. And we know that the virus is highly transmittable, so it is likely to reach all the way across the state. We know that we can, so then our next question is really, how do we use the time that we have to prepare? And a key thing is to build on the relationships that rural Minnesota is known for. So we want to let the fact that we have more time help us to ensure that we're better prepared to deal with it when we have to. So we're encouraging people to be in touch with local public health so that you can work with them on testing and contract tracing, especially in smaller communities. It can be easier to identify contact transmission. And so when we can do that, we can be better prepared to isolate people who have had the disease transmitted. We can use the time to educate the community on how the disease is transmitted, what to do when you think you've been exposed, where to go for testing, what to do if you have to isolate yourself or your family members or coworkers, patients. We can use the time to prepare for businesses and how they're going to reopen. Our Department of Health website has templates for businesses to use to plan how they're going to protect their workers and how they're going to keep the disease from spreading through the workplace, and then to help them identify and change business practices that will minimize the risk of transmission when people are back at work. One particular question that was asked is, in tourist areas, you know, what can we do? And this is time also to work with local businesses to be prepared to maintain some different practices. We want tourists to come, but what we want to do with them is a little bit different to make sure that our businesses are running safe practices. So we may have to change the way we interact with people when they do come. We'll want to build more physical distance into activities, but we really want to keep in mind, and it's the point that commissioners both made, is that people want to know that you have their safety in mind as well as your own safety. So the modeling isn't perfect, it can't tell us everything that we want to know, but because we know that the virus is highly transmittable and that many people who have the virus are asymptomatic, we know that we need to do more testing. And the Department of Health is working with Mayo and with the university and with many other healthcare providers to to increase testing. And as we do more testing, we'll learn where the virus is. We'll be able to track where the outbreaks are happening. And then again, we'll be able to isolate people who have been infected. And we're also increasing contact tracing. Many people in the department have been reassigned to do contact tracing throughout the state. And we just want in your own communities to encourage people to share their contacts when they're asked so that we can continue to find out where the disease is and to help people identify who needs to be quarantined to help slow the transmission again. Rural or urban, both, social distancing really matters. It's really easy to be complacent and to think that because it hasn't reached our community, it won't, but testing is still too limited to be able to know that we've been able to identify everybody who has the disease or has the virus. And so we really want to encourage those practices. Social distancing and sheltering in place so far has really helped flatten the curve in Minnesota, and that has allowed our health system to kind of catch up a little bit to where it needs to be, if we do have outbreaks or when we do have outbreaks. And these practices also can help keep us from being exposed and from exposing other people if we're carriers. So those are also key things to encourage. And just to remember that the social distancing and sheltering in place, it gave us time, but it didn't eliminate the risk that we're facing. It did help us think about preparedness and what that means to our healthcare system. And now we can continue to use that additional time to think about preparing for the rest of our economic system. So to this end, we want to encourage people to, again, work with local public health to have a plan for when the virus comes to your community. To make sure plans are actionable. We don't want to inspire panic, but we really want people to be prudent and prepared and to think about what they would do if they need to be tested, they need to transport a loved one, they need to isolate, to think about that ahead of time so that we are prepared. We need to also think in our communities about where is it difficult to do social distancing and work on plans to help mitigate that. And again, to work with community facilities so that they have a plan that allows them to reopen safely. So that is mainly my message, is to be as prepared as possible, to encourage those safe practices, to use personal protective equipment, even when it feels a little odd to do it. And then the message that the commissioner ends every talk with is to wash your hands with soap and water and use hand sanitizer, to avoid touching your face, especially eyes, nose, and mouth, with unwashed hands, to stay home if you're not feeling well, and to keep up to date with the information that's available on our website. We have, that information is being updated constantly, and we're trying to make it as accessible as possible.
Great, thank you, Zora. Now we have a few questions here. So the first one is kind of that big question. Does the Department of Health or the state have a plan for extensive statewide testing, and how will it be implemented in rural areas? Yes,
so the state is implementing testing. They're working with the larger systems and through a whole host of clinics, community clinics, federally qualified clinics, and are linking that effort. So there is an effort to try to reach any place where or to try anybody who's symptomatic and to be able to then trace where it's happening from there.
Okay, and so
we'll continue to roll out over time, but that effort has gotten underway.
Okay, how long do you think before it reaches to like all corners of the state? Because people are really just very concerned about finding out when they'll be able to reopen their communities and just have a better idea of what's going on.
I believe that the way it is working is it will be in any place where it's been identified, and then we'll continue to reach out as tests become available. I mean, there are still shortages of things that we need. One of the things that we're doing through the grant program is funding, providing funding so that clinics and hospitals can have the equipment that they need to continue ramping up testing. and it will just continue to roll out. I can't give you a date when every area will be filled, but I think the goal is to very shortly have anybody who is symptomatic and is questioning it to be able to have access.
Great, okay. So now some community leaders are wondering, when this all hit, we had to shut down the whole state, with a blanket shutdown. As we start to open up again, is there going to be any possibility of communities being able to use some discretion on their own to be able to, say, open community by community, or maybe say, instead of a stay-at-home order, a stay in your community order, and instead of doing these blanket solutions?
Yeah, I don't know of any specific plan to do that. I know the governor, when he spoke yesterday, has kind of a plan that is for the next few weeks through, and plans to update again by May 18th. And I think what they will continue to do is look at the data and look at what's happening around the state and make the determinations on that as needed kind of basis.
Okay. We have a question here in our Q&A panel. It says, it asks, data from my rural area is slow in getting to state maps. Is this always going to be true, or do you expect that data pipeline to speed up?
Oh, I wasn't aware that the data wasn't getting in. I know we get the department website is updated, I think, on a daily basis as they have reports.
Yeah, we've heard from a few places around the state anecdotally that the data isn't necessarily, or like people know locally about cases before they appear on the state website, by a couple of days sometimes. So
I can ask about that.
Okay, great. And then I think you may have, in what ways is the Department of Health working with tribal communities to get the word out, help them, with safety issues?
Yeah, we have provided funding to, I believe, all of the tribal nations in Minnesota through the emergency funding package that was first released, and it is open there. And the Department of Health has a tribal liaison who I know meets with tribal leadership every week, and I believe the commissioner as well, to talk about what their needs are, and to make sure that they're aware of all the resources that are available. And I know our office, we forward on information that comes in that is related. Like there was a recent federal HRSA health department has released some funding programs for tribal nations, and so we make sure that word gets spread.
Okay, thanks. And then one more here. We hear discussions about the virus coming in waves, and like there will be a second wave in the fall. How concerned do we need to be about this, and will waves hit in different parts of the state at different times because of the population density differences?
I do believe that the thinking is that outbreaks will happen in many ways, and unfortunately that is the thing that modeling isn't able to predict where that will happen. And there is a belief that it will happen, that there will be waves. And this is information that we're getting from the CDC. And that is a different part of the department. That isn't something that I have a lot of knowledge about how that's transmitted. I think we're learning every day new things. And so both with the modeling, but also with the information that is being used to make decisions, that every day it's getting better. And as it gets more complete, we'll be able to make, better determinations and let people know. I think transparency of what we know is one of the biggest ways to help people be prepared, and that is what we try to do.
Great, thanks. And Julie, did you have any more questions? No? Okay, I think we've run through our questions here.
Okay, well, thank you very much for the opportunity.
Yeah.
And if you hear from readers too, if there are things that we can do better, there are things that they need from us, we would appreciate learning that.
Great. Well, thank you so much for being with us today.
Okay, thank you.
Thank you so much, Zora. We really appreciate it. All right. Well, I think that is the end of the webinar today. We wish it could have gone longer, but we know schedules are tight, and we were happy to get commissioners on, and we hope that this answered some questions for you, or at least gave you some insight in what's going on in rural Minnesota. And again, before you all go, just make sure to check out our website at ruralmn.org, and we hope to talk with you and work with you guys all in the future. Have a great weekend.